the Caregiver Connection podcast by Best Care, where we dive into new topics each week, drawing inspiration from our insightful and educational blog posts. We're committed to providing valuable information that impacts both home care clients and caregivers. Without further ado, let's jump into this week's episode. Managing OCD in children through home care. Obsessive-Compulsive Disorder, also known as OCD, in children is not just a phase they will outgrow. It is a mental health condition that requires careful management and support. The International OCD Foundation estimates that around 1 in every 200 children has OCD. As a caregiver of a child with OCD, your role is crucial in helping children navigate the challenges of their disorder so they can live a happy, fulfilling life. Let's explore effective strategies for managing OCD symptoms in children while providing home care. We'll also cover the signs and symptoms of OCD in kids, as well as practical coping mechanisms. Understanding OCD in children. Understanding what causes OCD in children is complex. It encompasses a mix of genetic, neurobiological, and environmental factors. Children with other developmental behavior conditions, such as ADHD, depression, or eating disorders, are at a higher risk of developing OCD. OCD in children involves recurring, uncontrollable thoughts, or obsessions, and repetitive behaviors, compulsions, designed to alleviate the distress caused by these thoughts. Symptoms of OCD in children. Early detection and intervention are key to managing the condition effectively. Look for signs of OCD in kids, such as extreme distress over minor issues, frequent reassurance seeking, specific rituals that interfere with daily life, excessive hand washing, checking doors and locks repeatedly, and organizing objects meticulously. While these actions may provide temporary relief, they ultimately reinforce the anxiety, creating a vicious cycle that is difficult to break. How to help children with OCD. If your child has been diagnosed with OCD, your healthcare provider will have specific tools and resources to recommend. Here are a few examples. Avoid OCD triggers. These can vary from person to person, but are essentially anything that causes serious emotional distress to the individual. Identify what they are for your child and try to reduce their exposure to them. Try cognitive behavioral therapy. There are special forms of CBT designed specifically to treat OCD that may prove helpful for children. Do not accommodate or draw attention. Try to have conversations with your child and as a family that do not focus on OCD. Often, spending too much time talking about the condition can almost reinforce the obsessions. On top of that, if your child is pursuing an urge, try not to assist them. For example, if they ask you to open a door a certain amount of times, do your best not to do so, even if it feels hard. To do so will only strengthen the compulsion and reinforce the urge. Approach with understanding. It may seem like your child is being deliberately confrontational or difficult at times. Remember that this is often equally distressing for them to experience their compulsions. Treat them with compassion and patience. Seek support for yourself. It can be tough to see a loved one go through something as difficult as OCD, so find a support group or a therapist. There's no shame in asking for help. For OCD in toddlers, early intervention is crucial. Simple age-appropriate CBT techniques can be introduced to help them cope with their obsessions and compulsions. Engaging them in play and activities that distract and relax can also be beneficial. OCD coping mechanisms and support. As caregivers, it's vital to establish a stress-reducing environment. This includes maintaining a consistent routine, providing a calm atmosphere, and avoiding conflict over OCD rituals. Understanding that OCD in kids stems from anxiety and mental health can help you react with patience and compassion rather than frustration. Lastly, support for the family is equally important. Attending support groups, engaging in therapy sessions, and learning more about OCD can help relieve feelings of guilt and helplessness. Remember, managing OCD is a collective effort that involves care, understanding, and patience from the whole family. Managing OCD at home can be challenging, but with the right strategies and support, it is possible to create a nurturing environment that helps your child thrive. At Best Care, we are here to help answer all your questions related to family caregiving. Contact us today and learn more about how we can support you and your family. If you find this podcast helpful, share this with a friend, leave a review, and don't forget to subscribe. Contact us today for expert guidance and support. Visit bestcaremn.com. Thanks for listening to the Caregiver Connection.